In May, we invited every team to identify activities that you considered were of little value to patients and staff and that potentially could be stopped. And we're very pleased now to feed back to you the results of that piece of work, that initial piece of work. We had lots and lots of interest in trying to figure this out on the website, so thank you for that. But we also got quite a bit of feedback that it was quite a difficult thing to do, trying to identify activity that we could stop doing. You'd have thought people would feel there was lots that you could stop doing. We did, however, manage to generate some ideas about what we could stop doing, and the QI team have been working with those teams who've identified those ideas to try and put them in place and take them forward. Kevin will tell you a bit more about those themes.
Yeah. So we've had a number of really good ideas sent through to us by staff. Some were so simple that we're able to enact them straight away. Others have required a little bit more thought. One thing that's come through very strong is around duplication of meetings and being more efficient about the number of meetings we have, decrease the number of meetings, and indeed removing meetings if that's possible to do so. And one team already has managed to save over 20 hours of staff time a week just by changing how they run their meetings. I understand that people quite understandably feel reluctant to come all the way up to Trust HQ for all of their training. And of course, we are always very happy to see you, but we've done a lot of work now to look at how we can prevent staff having to come up here all the time to do their training, and to provide statutory and mandatory training wherever possible outside of Trust headquarters and closer to base. And finally, we've had a number of representations from staff on duplicating clinical information. We really do understand how frustrating it is having to enter clinical information onto several different systems. It is clearly, if possible, unnecessary and a duplication and a waste of staff time. So we're doing a lot of work now to ensure when we move to the new clinical record system that this duplication is wherever possible removed absolutely and kept to a minimum if it's not possible.
Thanks, Kevin. So once again, I'd like to thank everybody who took part in this little project and to the teams who've taken it that step further to develop the initiative. This work is really important if we truly want to deliver high quality care. And we need to be able to work differently, not just harder, and we need to make the space and time to be able to do that. So identifying activity and work of low value is a crucial part of that. So if you're interested in finding out a bit more about the initiatives and the work that people are already doing, please do visit the QI microsite. And in the future, we will try and repeat this process again, this initiative again. We'd really like to do that. To have some ideas about what we might do further, do find out what the other teams are doing. If you, in the meantime, have some ideas about what you might like to do, contact the QI team and one of the guys there will guide you through what we could do. Thank you.